I'd like to introduce our first speaker, Dr. Watanabe, who will be presenting Surgeons Have Knowledge Gaps in the Safe Use of Energy Devices, a multi-center cross-sectional study.
Good afternoon. Here's my disclosure. Despite the wide use of surgical energy devices and the potential for rare but serious complications, pilot data for North America suggests that the surgeons and the surgical trainees have no suboptimal knowledge in their safe use. To address these gaps, CESIS has recently established a web-based didactic curricula known as Fundamental Use of Surgical Energy FUSE in an effort to promote the culture of the safety for the safe use of surgical energy devices. Such a knowledge gaps has been demonstrated in relatively selected populations. In order to understand the true extent of this safety problem, and in order to determine whether efforts need to be disseminated globally to promote such educational curricula, it is important to determine the knowledge level in other populations. So the purpose of this study was to determine the baseline knowledge of surgeons and surgical trainees at all levels in Japan regarding the safe and effective use of surgical energy devices. Surgeons and surgical trainees from 10 academic centers and 5 community hospitals were purposefully invited to participate in this study. And we used a 35 items questionnaire assessing fundamental knowledge of electrosurgery that was previously developed based on 35 objectives from FUSE curriculum. The examination consists of 4 sections: the principal, adverse event, monopolar and bipolar devices, and the pediatric considerations, and the interference with implantable devices. The test was translated to Japanese by 2 surgeons and 1 clinical engineer, and then finalized by an external professional translator. Here's the results. So 145 participants completed this study, and 40% were surgical residents, and 60% were surgeons. The mean total score on the exam for entire cohort was 58%. The mean total score for the surgeons group were higher than resident group. However, their knowledge level was suboptimal. Now, in terms of subsection scores, while the surgeons group were higher performance than resident group on all subsections, again, both groups had a suboptimal knowledge across all sections. In the section of the adverse event and the pediatric consideration and the interference with implementable devices, the surgeon group had a significantly higher scores than resident group. Here are some interesting findings from the result. Amongst all participants, 90% of the participants were not familiar with best practice when using electrosurgery on patients with a pacemaker. 40% of the participants believe that the electrosurgery uses thermal energy from cautery. 20% could not prioritize the steps of managing an OR fire. 30% of the participants believe that installation failure is mostly visible under the careful inspections, but it isn't. So in conclusion, surgeons and surgical trainees at all levels in Japan have a knowledge gap in the safe and effective use of surgical energy devices. There is a need for curricula to help address these gaps and contribute to safer surgery in Japan. Thank you.
So this paper is now open for discussion again. Feel free to use the app or to approach the microphones. So I have one question, which would be, so you've clearly identified a pretty significant knowledge gap. And what's your plan to go forward? Are you going to create an intervention? Are you going to use Fuse? Are you going to do something that's specific to meet the needs of surgeons in Japan? Or what's your next step?
So thank you so much. So basically, we did some Fuse simulation course in Japan already, and we found the effectiveness of this course. So this is, I would say, I will promote this curriculum, and I will bring this curriculum to Japan to promote the patient safety issue, to improve the patient, to optimize the patient safety.
Just a comment for you. You know, I don't know what happened in Japan, but what happened in many Latin American countries where I work. Most of the time, I'm the executive director for the Federation of Latin American Surgical Societies. So I believe that we should teach this since the school, since they start the internship to the hospital before, because, you know, these are tools that are being used in an everyday basis. You know, we don't have to wait that they finish the resident to take a course. You know, I think in a way, you listen one of the master's presentation today, you know, the way that we have to change the surgical specialty, the way that we are going to teach it in the near future. So I think these are topics that should be included since the beginning, and not to wait till the end of the residency and to compare, because this is tools that are being used for everyone in the operating room, and that's mean technician, nurses, doctors, surgeons, etc. But I think meanwhile, to have a tool like we have from SAGES, I think will be very, very useful. But I think instead to have courses at the end, or you know, and to be validated, I think we should teach them since the beginning. I don't know your opinion.
I completely agree.
I completely agree. My goal is to integrate this curriculum to medical schools. That's my goal.
Excellent.
Thank you.
Well, we look forward to further work. Thank you. Nicely presented.